Cardio and strength training are both effective exercise types for managing diabetes, but they improve diabetes risk factors through different processes or mechanisms. In this video, I'm going to discuss the benefits and mechanisms specific to both cardio and strength training as they relate to diabetes management. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. In type 2 diabetes, both cardio and strength training are effective in improving blood sugar levels, reducing inflammation, boosting mental health, and improving cardiovascular health. And the strongest effect is when both of these types of exercises are included in a workout routine. Even though both of these exercise types help to improve diabetes, the mechanisms of how each of these exercise types affect insulin resistance are different. Cardio or aerobic exercise is essentially continuous movement of large muscle groups to the point that it increases your heart rate and your breathing rate. And so this will be things like walking, biking, jogging, and the current recommendations are doing aerobic training or aerobic exercise at least 3 days a week and accumulating at least 150 minutes per week of this type of exercise. Strength training is when you're pushing or pulling against some type of resistance with the goal of improving muscular strength and muscular power. Now, this can include weightlifting, this can include using resistance bands, body weight movements like push-ups, and machine weights as well. And the current recommendations are training all major muscle groups for at least 2 to 3 days a week. When it comes to how these different exercise types improve diabetes, let's look at blood glucose management first. In the short term, cardio has been shown to be more effective, just slightly more effective at lowering blood sugar levels, but when done over 9 months, strength training has been found to be more superior at lowering A1C. And part of the reason that strength training is better than cardio long term at lowering A1C is because of the muscle building effect of strength training. Muscle tissue is metabolically healthy tissue, and the more that you have of it, the more opportunity you have for your muscle cells to help to pull or clear that glucose out of the bloodstream and improve insulin sensitivity. And more muscle tissue also raises your resting metabolism, which means you're going to be burning more fat at rest, including visceral fat. And so visceral fat is the fat that surrounds our organs. And this type of fat, whenever it's found in higher amounts, is really harmful to our health. When we look at other diabetes risk factors, both cardio and strength training seem to be good at lowering body fat. Cardio tends to be better at improving cardiovascular health and improving blood lipids like cholesterol and triglycerides. And strength training is going to be better at increasing muscle mass and also improving insulin sensitivity.